Metabolic syndrome, a condition that consists of high blood pressure, insulin resistance, and obesity. A 69-year-old man presented to us with this very condition. He had pain in his legs, headaches, and he felt low energy. And despite the physician adding more and more medications, he felt like he was going to die. He presented to us for help. Here's what we did next. So, Camille, tell us about this 69-year-old man with metabolic syndrome.
So he had uncontrolled blood pressure and diabetes despite being on 5 medications, and he had obesity. And he had frequent headaches, probably related to the high blood pressure. He had palpitations, really low energy, and leg pain. And he was really fearing, what else would he start to feel? What would be the worst outcome? And he came here looking for another solution because adding all the medications never seemed to solve the problem, and he felt really sick.
It's interesting because patients like this gentleman can be very difficult to manage. He has 3 potentially life-threatening conditions. High blood pressure is considered to be a thief in the night. Diabetes has many complications such as kidney failure, stroke, heart attack, and of course, morbid obesity is an underlying abnormality that's associated with lots of chronic illnesses. So not only that, you have a condition, this metabolic syndrome, where these abnormalities play off each other. The obesity makes the diabetes worse, the diabetes makes the obesity worse, and of course, both can contribute to the high blood pressure. So you have to treat these patients with an approach to the underlying change in the metabolic abnormality. And many times these patients have increased inflammation and increased oxidative stress. And the approach we take is try to address these problems and hopefully this metabolic process and turn around. So what was our initial finding on evaluation?
So on evaluation, he had some mild leg edema. His blood pressure was 174/96. And then on our testing, we saw that his A1C, which is one way to assess diabetes and the blood sugar the last 3 months, it was very high at 9.7. Normal is less than 5.7. So we knew that could lead to lots of inflammation, and his inflammation markers were high. His pumping of his heart was reduced, and he had findings on imaging indicating small vessel disease.
So not only does this patient have elevated blood pressure, obesity, but now we found that he's in heart failure and he has some evidence of disease, which means he probably has coronary disease. So he's at risk for progressive heart failure, heart attack, or stroke. So this patient is much sicker than he appeared on the surface. And oftentimes that's the case with patients like this. And many times we may treat them with medication after medication to treat the high blood pressure. You may give them medication for obesity, you may give them medication to get the blood sugar down for diabetes, but the underlying problem is not being addressed. And these sicker patients can only get worse over time. So I'm glad that he came to us when he did, because I think we got to him in time. So how did we intervene on this patient?
Well, we met with the nutritionist and the culinary team and prescribed him a nutritional detox. So we did that for about a month, and then he did incorporate cooked foods as well that were all plant-based. We also put him on Vascular Assist, which is a supplement containing L-citrulline, which is a precursor to nitric oxide to help circulation and blood pressure. And we put him on some CoQ10, which helps energy production in the cells and the heart.
So an anti-inflammatory nutritional cleansing diet followed by a plant-based diet was really the core intervention with some limited target supplementation. What I'd like to point out is that a patient with such complex set of medical problems can really be treated effectively and rapidly with a very simple approach. And we have lots of scientific evidence showing how an anti-inflammatory defined plant-based diet can have a major impact on high blood pressure, high cholesterol, heart failure, and coronary disease. And we published this in the literature. So I'm very glad that you use this very straightforward approach along with medication wean, which we found to be very important as well. So I look forward to seeing how he does. So how did he do?
So he did great. He lost 50 pounds over the course of a year and a half, and his marker of inflammation, the C-reactive protein, normalized, so it decreased by 85%. And he also reversed his diabetes, all while we weaned him off all of his diabetes medication. So now he was controlling his blood sugar naturally with his diet. There were times where he regressed, and sometimes he'd add back other foods, animal protein, fish, and I'd see that with the higher blood pressure. So We frequently met with the nutritional team and he got back on track.
Wow. This is an impressive story. Oftentimes you talk about patients that come in, they turn around in a matter of 3 weeks, 4 weeks, and this gentleman turned around in a matter of about a year and a half. And as you pointed out, there were times where he regressed, he went back, but he always got back on the program. And this is to underscore the importance of sticking to a program. We're not all perfect. However, with ongoing coaching and the tenacity that he maintained to get back on the program when he fell off, I think is very important. And so again, whether or not you're perfect is not so much the important thing, but you have to be consistent and steadfast. So I'm really impressed with these findings, and he was able to do it while coming off medication. There's more work to do. As we continue to work with him, we anticipate getting him off these other 2 antihypertensive medications. So again, a fascinating case. And I hope you got a lot out of that. And as usual, if you have any questions or comments, leave them in the comments section. And until next time, take care.
Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.